All right, so my name is Sebastian. I am a physical therapist. I'm 31 years old. I graduated PT school in 2019. Before I did that, I worked at a sports performance facility in Indianapolis, Indiana, where I'm from. I was a coach and a trainer all throughout graduate school, so I'm no stranger to early mornings and late nights. I would go train clients before PT school, study on the train, and then I would study on the train on the way home and coach more clients. I did that for about 3 years. I went to Pacific University out in Portland, Oregon, or Hillsboro, Oregon. The reason I went there was because I wanted to get out of Indiana, and it reminded me the most of Germany. My family is from Germany. I'm first generation German American. And some of my other habits are physical activity. And that's why I really like to kind of share some of these things with people, because my biggest satisfaction through work is obviously there's like the low-hanging fruit of helping people, but I really love understanding the human body, explaining it to people, and most importantly, not just helping you feel better, but helping you have a better understanding of like why things occur and how you can manage them, give you a little bit more autonomy in your self-care. So this talk today is going to be hip pain resolution and or how to manage hip pain. And obviously this isn't a replacement for going and seeing your doctor or coming and seeing me or one of the other therapists in our clinic. However, it is going to be giving you some information to kind of understand like how the hip works, what's involved with the hip, and some common strategies that I would use with you if you were to come visit me in order to make you feel better, okay? So without further ado, I'm gonna go ahead and I'm gonna do some demos with skeletons and with an old school anatomy chart. The anatomy chart won't be up long because it's kind of hard to see. It's laminated in the way that makes it blurry. But right here in front of me, and I'll kind of just stand up, I have a pelvis. So as many of us know, our hip joint is the top of our leg, right? But you may or may not know that it's a ball and socket joint, or at least people that tend to be stiff in this area might not perceive that it is a joint capable of such great motion. This hip joint is scientifically called the femoral acetabular joint. Your femur, the head of the femur, articulates within the acetabulum, but also the pelvis can move on top of a fixed femur. That's something really important to kind of consider as we move on. Our legs don't just swing freely in the air, but rather the most common motion that we produce from our hip joint is actually orienting our body around this hip joint. So if you've ever seen anybody kind of walk like a cowboy or walk with their toes pointed out or be knock-kneed, that's an example of a person that doesn't really move that well through their pelvis. When someone doesn't move well through their pelvis or through their hip joint, whatever action of motion that they do have, the muscles that are responsible for that are going to be chronically used. I use the term compression, but we can just kind of talk about things as tight. So if someone can relate to having a tight hip, has anybody in the crowd got a tight hip or experienced a tight hip? If you have, just say yes in the chat. I've had a tight hip, so I would imagine most people have as well. But you also might feel that you might have muscles on your hip that feel like they're always kind of loose or unstable. So if you're using one set of muscles all the time, there's a chance that you're not using other ones. And if we don't have dynamic motion throughout our body, especially the part of our body that keeps us connected to the earth, you're going to have these experiences where things feel tight or things feel weak or things feel kind of stretched out all the time or kind of sore to the touch. And I'm going to dive into that a little bit more. But the last thing I'll say while I've got the skeleton in my hand is that we have this femoral acetabular joint, this hip joint, but it's intimately related to the bottom of our spine. It's also intimately related to the knee, because on the other half of this beautifully complex ball and socket joint is your knee. On the other half of your knee is your foot, which is also very, very complex. So not to make a bad joke, but I kind of think of the knee as the middle child between those two really complex parts of the body. If you have a dysfunction here, you often have a dysfunction here or at the knee. But I tend to look at someone from the entire person. So when someone walks into my clinic, I always look at hips, but I always look at shoulders. I always look at hips and I always look at shoulders because if you look at this pelvis, there's a ring of bone. This ring of bone is inherently pretty stable, and it's attached to two ball and socket joints, which allows it to also move pretty well on top of something else. When we move upstairs, we've got the rib cage and a ball and socket joint, that being the shoulder, that moves around that. We're not going to get into this that much, but I want you to kind of think about my process of thinking is going to involve both of these normally. The last thing I want to say while I have the skeleton in my hand is that everybody wants to have that six-pack muscle, right? That six-pack muscle is the beach muscle. It looks good. It's kind of the one that you want to show off when you're at the gym or whatever. Maybe some of the older folks in the crowd, those are days gone by. However, you remember. Everybody remembers a guy or a gal that had a nice six-pack. However, those are show abs, and I'm more concerned about performance abs. And I call them performance abs because the six-pack attaches just to this tiny little point right here. I call it the belt buckle, but it's like your pubic bone area, just below your belt buckle. And then it attaches just to a tiny little piece of the bottom of your sternum right here called your xiphoid process. So you have this big fancy muscle that looks good, but it really only attaches to two tiny pieces of real estate. If we want to reverse back to how the hip can, or the pelvis can move across the hip, I'm starting to think of what muscles control the spinning of this over my hip as my foot is on the ground. And that's going to be muscles that attach to the top of the rim of the pelvis on both sides, and then to the bottom of my ribs and my entire rib cage. They allow me to turn, not just fold over. Now, just to quickly show you this, I'm gonna try to make it not glared. Let me turn down my brightness here. Hold on one second, function, reduce brightness. So you can see, I hope that's a little bit better. So when we're looking at this anatomy chart, you'll notice that these big muscles on the side of the abdomen attach to the bottom of the pelvis, or the top of the pelvis and the bottom of the rib cage. This six-pack muscle just gets really small and attaches there. So now you know what you're looking at when I'm talking about these things. Furthermore, there's 3 layers of muscle at the abs, rather than just one that covers the entire real estate of the bottom of the rib cage and the top of the pelvis. Now, I'm going to flip my camera around here and play around with our big skeleton in the clinic. But when people come into my clinic, and they have our clinic, I should say, but will come into my room in the clinic, they complain of typically 2 types of hip pain, if not back pain and knee pain on top of that. The first one is, Sebastian, I have this pinch at the front of my hip. Every time I sit down or I bring my knee to my chest, I have this pinch at the front of my hip. Or they say, Sebastian, I have this kind of sore spot right here on the outside of my hip, right here on the outside of my hip. It just kind of feels weird when I'm walking around. I walk around and after a couple minutes, it starts to hurt. Or the infamous SI joint pain. Sebastian, I have pain on either side of my low back. It's not in the middle. It's kind of here, or it's kind of right here. Has anybody in the group ever had pain in one or all of those places before?
Mm-hmm. Yep.
Yeah, me too. I mean, it's totally normal, right? The 21st century human, we have behaviors that create, remember, if you move one way, if all you can do is hammer, then everything's a nail. Well, if you only move in a certain way, then you only use certain muscles. You only squeeze or compress certain parts of your joints. The key to this, my friends, is learning how to move here and then move this pelvis over a femur. I'm going to go ahead and flip my camera around right now, and we're going to go ahead and start talking about how we can look at how this action works. So I'm going to go ahead and flip my video around. Hold on, give me one second. I'm not technically advanced here. I'll do my best though. So I'm going to put my phone underneath this thing so we can see a pelvis. In whole skeleton. I'm going to go ahead and put the arms behind. Now, we have the same structure that we were looking at earlier, but now we have the rib cage and we can realize this a little bit more as the whole body is. When I take both of these legs up, I want to show you the power of moving your pelvis over your femur. When I'm walking around, standing, or shifting my weight, I want to be able to push one femur back and pull one femur forward. Does everybody see how that turns me left? Then I want to be able to do the opposite. Pull my left femur, or push my left femur forward and pull my right one back, it turns me to the right. What often happens, and this is what I see on a daily basis, is that people cannot do this anymore. They lose somewhere along the line, whether it's to injury or habits, the way we move around, movement behaviors, they lose this ability. And when you lose the ability to be dynamic and go left and go right, again, you become a hammer and everything's a nail. You only use certain muscles. If the motion doesn't happen at these nice ball and socket joints, if anyone has grandchildren or children of their own, you could ask any of them and they would tell you that there's more surface area or a bigger bone at the hip than there is at any of these little vertebrae at your lumbar spine, or here at that SI joint. The reason I mention that and why that's important is because if you lose motion here, your brain doesn't care. If you have to go to your garden and pick something up, if you've got to load groceries into your car, if you want to walk somewhere, if you trip and you stumble, if you're doing literally anything and you don't have the requisite motion at the joint of your lower body that's designed to move the most, you will compensate somewhere in order to accomplish that task. That's just a basic survival mechanism that our brain has. It would rather do task than to preserve motion elsewhere. I kind of mentioned the knee as the middle child between the foot and the hip. The lumbar spine is kind of the middle child between the rib cage and the pelvis. When one has dysfunction here, you either feel pain at the lumbar spine, at the knee, or at the hip itself. Now, the way that we start to address that is that we have to learn how to control the motion of this bad boy, this pelvis, so that our hips are positioned in a manner for the muscles that control it to work optimally. I want both sides of the be able to work in a lengthening or shortening motion and a lengthening motion, okay? And the way that I describe these things is that when something on the front squeezes or shortens, stuff on the back has to lengthen or expand. When something on the front side of my body on the left shortens, often you have the opposite happening on the right side. So when I kind of keep talking here, I want you to think of the hips as having two, obviously, a front and a back of each. And I want you to kind of think of things as long and short as I continue here, okay? So if we have two hips, each having a front and a back, you can think of us having a square looking from the top down, divided into four smaller squares. A back, I'm going to talk how I'm looking at the skeleton, a back left, a back right, a front left, and a front right. What that would look like on my body is, I'm going to show a little, I'm going to be humble here, but I have a back right, a back left, and then a front right and a front left. Without giving you a whole bunch of anatomy, I just want you to kind of understand that there are muscles on the back and the front of your body. And you're going to have the same ones on the left as you do on the right, unless you have some sort of structural anomaly or you had something removed back in the day or over the course of surgery. Now, I'm going to do a couple demonstrations of walking, and people may or may not have seen this before. But what I'm going to talk about is whether muscles are working on the front or on the back of my body, okay? So I'm going to walk towards the camera, and I'm going to only turn on muscles that are on the front of my body. And I have my belt buckle showing here. It's not the brightest belt buckle that I own, and I should have thought about this ahead of time. But I want you to kind of pay attention to how the belt buckle is going to move or not move. The first way I'm going to walk is I'm going to walk what would be considered the traditional quote knock knee position. That's just muscles on the front of my right hip and muscles on the front of my left hip working, being shortened or tight all the time, and muscles on the back of both sides being loose or expanded. So I'm going to walk towards the camera, and you'll notice that my belt buckle doesn't move at all, and I have that sort of pigeon-toed or that knock-knee position. So for those of you that know anatomy, I'm using the muscles of my inner thigh and my hip flexor to sort of drag me through space. This is people that have this sort of posture where their behind is hanging out in space. They have sort of that skinny fat belly, or maybe they have a belly and just pushes out a little bit more on the front of their body or the lower half of their abdomen. But what's most important is that they're not allowing their hip to rotate in a certain direction. They're not allowing it to open up so the backside of their body, of their hips, can shorten those muscles. So you're going to be walking like this. I'm going to go ahead and go backwards, and I'm going to show you what it's like to have the opposite. Now, if someone's only using the muscles on the backside of the body and not using the muscles on the front, you'll find that they kind of have that duck walk, or maybe they're that cowboy with the bowed out legs, and they're doing one of these. Everybody has been to the grocery store or knows a loved one or a friend that has one of these positions that they kind of have a strange way about walking. And some people will often tell you, like, I've always done that. And that's totally believable. And the reason that's believable is because everything that I describe is going to be a behavior. The way that we move through space is a behavior. It's a habit that we have to get a task done. The coolest part about what I'm about to show you now is that we can change these behaviors. The way that I want you to start thinking about walking isn't going to be neurotic or really narrowing down on the minutia of details. Rather, it's to just bring attention to kind of how you carry yourself through space. Now, the way that I'm going to exaggerate this, the way that an appropriate gait cycle or walking would occur would be that I'm going to push myself forward with my back left, and I'm going to help myself with my front right get onto my right leg. So when I push and I step, you'll notice that my belt is now pointing towards my lead leg. My back left is working, and my front right is working. As my gravity, or as my center of gravity passes over my right leg, I begin to now switch. I'm going to use the back right and then turn on the front left of my body, of my hip. And then I'm going to continue to walk through space in an orientating fashion. I'm going to go right, and then I'm going to go left, and then I'm going to go right, and then I'm going to go left again. That is not to be confused with this sort of turning of my upper body or swaying of my knees. It's a turning of my pelvis over my legs that continue to point straight. When I was playing with the skeleton and I was showing that sort of turning left and turning right, that's the action that we're going for. The exercises that I'm about to show you are going to break that down into finer details. Now, just to kind of show you what like healthy hips can do and should do, and I mean, I've had people up to 83 years old, I think is the record that I've had, is that when you have the ability to control your hips like that, you should be able to sit down into a squat as I am now. Many people think, oh no, my knees could never handle that. My ankles could never handle that. My hips could never handle that. Well, I've had folks that have had knee replacements go down this far. I've had people that have had painful knees for 10 years, painful hips for 10 years. Being able to squat like I am, very relaxed, just by restoring that left, right, front to back, turning off and turning on of their hip musculature. So you might ask me, well, Sebastian, how do I do that? Well, I'm about to show you. I'm glad you asked. The way that we do that is that we have to first, I'm going to bring my assistant back in. we have to first control what's happening here. We have to control what's happening at that bony ring, the pelvis, right? This is the important segment to consider. If this is out of position, there's no way that this can be in position. And if you remember kind of how I was mentioning earlier, those abdominals that are super, super awesome, well, they connect to the top of my pelvis and the bottom of my rib cage, and they seem to be a nice choice to call into action. I also want to be able to talk to muscles that are kind of near the backside of my hip, like I mentioned. So there's two different types of pelvis positions that I like to talk about. The first one, I don't know, I might date myself, this might completely miss, but I talk about Jennifer Lopez, right? Everyone's kind of seen that really arched back. Well, when this pelvis is tipped forward, these hips can only use the muscles in the front. And then you've seen kind of like that saggy, Eeyore type of posture where only the muscles in the back of my hips can be used and my butt's kind of hidden underneath me. And then you have that nice middle ground where someone can stand tall and then just hide their butt, but a little bit of it will peek out, right? It's not this and it's not this, it's rather tucking it underneath. So if you have the opportunity to, or you want to join up with me, what we're going to do is we're going to break out. I'm going to show you kind of the step-by-step process and how to feel these things. If you have any questions right now, would be the perfect time to throw them in the chat. Otherwise, I'm going to kind of keep on rolling. So I'll give a couple minutes while I set myself up.
Nobody commented in the chat, so everyone understands. They're right with you.
All right, perfect. Okay. When someone comes in, they've got hip pain of any sort, again, for me, at least, my first line of defense is just to make sure everything is able to be organized appropriately. Can you shift your hips like I did with that skeleton? And if you can, then I dive in a little bit deeper. But most of the time, if someone has pain that's kind of just like, come on, or comes on with activity, or they have sensations of chronic tension, this tends to be pretty useful for knocking it out. I'm going to turn to my left and go profile so you can see what I'm talking about. Now, what I'm about to show you can be done in any position. But when you start in a seated position, or in a position where you're lying on your back, it becomes a little easier to learn. So in order to get my hips underneath my body, to allow for that left-right action to occur, we have to talk to some muscles in the backside. And the easiest way to do that in sitting, for me, what I've found, is that I like my people to put their foot, namely their arch, directly up underneath their knee. So you'll notice, can you see my, Joe, can you see my feet?
I can see your feet.
Okay, awesome. Can you see my lower body?
And totally, I see your whole structure on this here. Yes.
So when I'm teaching someone how to do this, and I'm going to talk to you all like you're complete beginners because I've never met any of you in person except for Joe. I want you to put your arches directly underneath your knees, and then I just want you to relax, put your hands on your knees. And you're just going to kind of stay in this position because this is a nice place to be to make sure there's not a lot of unnecessary motion. From there, I want you just to push your heels as hard as you can into the ground. And what you'll notice when I do that, and I'll kind of go on and off, when I'm off, and then I'm heel pressure, you'll notice my hips just roll, or my pelvis just rolls right underneath me. It rolls right to where I want it to be. That is step number one to allowing everything to kind of open up. And when I'm talking to someone, I like to say, if you were to build a house, would you just throw up some walls? Or would you make sure that the ground was nicely leveled and the foundation was set before you started building the structure? I've never met a person yet that say I would just throw up some walls, because everybody's heard of the Three Little Pigs, and we all know what happened to the first two. Not enough planning. So I always want you to kind of think about setting this up by pushing the floor away with your heels. And when you have that, I want you to hold it. And I want you to take a little pause and think about what muscles are working. When I'm pushing through my heels, what I feel right now and what I want you to feel is I want you to feel the muscles sort of at my back pocket. I want you to feel the muscles kind of where your behind meets your thigh. That's going to be your gluteus maximus and your hamstrings. Those muscles are strong and they have a lot of good leverage to help us keep our pelvis where it is. The reason I like the heel is because when you push through that, it turns those muscles on. But when I'm not sitting in a chair or lying on the ground, I'm always on my feet, unless I've done something wrong and then I'm tumbling. I'm always on my feet. So I can push through my heels and I can always find that part of my body by creating something off the ground, and that's a nice push. So again, one time, I'm gonna go ahead and push. I'm gonna hang out here for just a couple seconds, and then I'm gonna let it go. And then I'm gonna push, and then I'm gonna let it go. And then I'm gonna push, and then I'm gonna let it go. What we're gonna do now is we are going to add the other half of the puzzle. Remember, we had the muscles below the hip, or on the backside, but we also have that other area of our body, the abdominals. And the reason I mentioned those to you earlier when we first started this was because I want you to be able to help lock in this position with your pelvis by using your heels, but also using your breathing. Everyone that's on this call, myself included, I hope you plan to keep on breathing, because it's probably the most important thing that you can do today and tomorrow and for the rest of the time. And the way that we can use our breathing is the way that we can turn on our abdominals without having to do anything special. So a lot of times people will say, pretend like you almost got punched, or pretend like you got into a cold pool. Well, I don't have time to be thinking about being in a cold pool or almost getting into a fight when I'm loading stuff into my car, when I'm picking up the children that I don't have, when I am doing exercise of any sort, walking. I have to be able to breathe and go about my business. So we're going to layer these things on top of each other. The first thing we're going to do, everybody, is we are going to push our heels hard into the ground. I want you to make sure you feel your pelvis rolling underneath you, that you feel that back pocket, that butt crease area of your body kind of becoming tense, shortening up. Everybody go ahead and do that and hold. If you can't get it, put something in the chat room. If you're not doing it, don't worry, just ignore this. The next thing I want you to do is I want you to notice I'm going to kind of arch my back. I'm going to put my heels in the ground, get my hips underneath, but I'm going to kind of arch my back for show. You'll notice you can see my ribs here. Well, when I push my feet hard to the floor and then I blow out all of my air like it's my 100th birthday and there's tons of candles on the cake, it's going to drop my rib cage. I want you to watch that. It makes my belly pretty darn tight. And now all I want you to do on top of that is keep pushing onto the floor, hold your belly tight, and then breathe in through your nose. And you'll notice that my ribs don't fly up when I breathe. Now, you don't need to necessarily sigh all the time. The reason I use that strategy when I'm showing people how to do this is because it creates that 10 out of 10 abdominal contraction. It helps you feel the right things. I don't need you crushing the floor with your heel all the time, but I want you to, without a doubt, know what it feels like to turn your butt on. I want you, without a doubt, to know what it feels like to have your belly tight. So when someone comes and works with me, I always say, push the floor, push the floor. Do you feel this? Double thumbs up. Perfect. Blow out all your air like it's your 100th birthday and you need all the candles to go out. You feel your belly tight. Double thumbs up. Perfect. Now hold that position and breathe in silently through your nose. When we create the situation where we're really working to hold a position and we continue to breathe, it makes a nice little roadmap for our brain to return to a position. It creates new behaviors. Earlier on this call, I mentioned that a lot of times, chronic pain and the way that we move through space is very behavior-based. And then that can change. But we have to have a framework in order to create that change. And these two moves of feeling your butt by pushing through your heels and blowing out all of your air until your belly gets tight and keeping it there as you continue to inhale gently through your nose and blow out all your air is how you make that relationship, how you change that behavior. It's a lot like when you drive somewhere for the first time. Millennials can't get anywhere without Google Maps. I'm a millennial and I tend to remember where I'm going because I pay attention. But if you continually drive the same route every single day and you practice, you run into those situations where you find yourself just daydreaming and then all of a sudden you're at your destination. Movement behaviors work a lot like that as well. You pay a lot of attention in the initial steps of learning, only to find that these behaviors now become your modus operandum, your automatic way of getting through your environment, completing tasks. So I'm going to do this one more time so everybody can see, and then I'm going to show you how it looks in standing. I want you to go ahead and push your heels hard into the floor. If you have that paper towel roll, this is a good time to kind of just put it between your knees. I don't need you to crush it. But just kind of gently holding on to something may help you feel the backside of your hip working, the crease of your behind. I'm going to go profile so you can see me. But when I push my heels down, my hips roll underneath. I hold on to that paper towel roll, that foam roller. I keep my chin up, and I blow my air out until I hear it fade. And then I work hard to take 5 breaths here. And then I relax. So Amanda asked earlier about, have I heard of a hip hook? And I hadn't. But there is an entire market of structure, tools that help people soften tissues up that tend to be tight. If you ask me, why is that hip, if you ask me about a hip hook, I'll tell you, try the free version of turning on your backside first. When someone has that sensation of tension on the front of their body, it likely means that the backside hasn't turned on in a while or isn't very good at turning on. When someone gets into this drill, whether they're in a standing or seated position, and they turn their butt on and they exhale completely, what that does is that allows this to work, the abs to work, yes, but it also allows things in the front of the body to relax. What this looks like in standing, and I'm going to grab a dowel to hold on to, but this can be done against a wall, what I'm about to demonstrate. I'm going to pretend like I have a wall, like I'm going to do my mime. In order to feel your backside when you're standing, you have to soften your knees. So often through the work, I almost have a curse now. Jill does too. We walk through our environment and we just see people move. That's all I see anymore. Even my loved ones, I just watch them move. I don't coach, no unsolicited advice, by the way. But you just see these things and you can pick up on motor behaviors. Well, what I want everyone to do really quickly is to, if you're standing, again, I can't see my camera, so I can't tell, but I'm going to keep on going. What I see every day is people being very locked out in their knees. And if I lock my knees out, bam, it automatically throws my pelvis forward. My weight shifts onto the front of my feet. If I hold this position, I'm going to hold my down and I just bounce up and down, just giving myself gentle perturbations. You can try this yourself. Shift your weight to your heel or to the front of your foot, lock your knees out, let your belly flow forward. When I do that, I feel my lower back. I feel the pinching in the front of my hip. I feel my knees jarring. Imagine now every step you took was in that position and you couldn't get out of it. There's no wonder that you have pain in the back side of your body because your back's arched. Pain in the front side of your hip because your pelvis is pinching all the beautiful muscles in the front side of your body. That your knee can't bend and absorb forces. Now, I'm going to show you the way to fix that. I want you to soften your knees. I want you to push your heels hard to the ground so you feel your hips just gently roll underneath you. I want you just to look up and now go up and down. And what you'll feel, I can almost guarantee it if you're feeling your hips working, the pressure on your heels and your knees soft, is you're going to feel your body bend. You're going to feel your body bend in a way that it absorbs forces through the muscles of your body and not the joints. If you can move through space like this, you're going to be able to free yourself from those nagging pains. You're going to be able to go on a walk with your loved one or your children or your pets. You're going to be able to go skiing or snowboarding if that's something you're into. You're going to be able to hang around, do yard work in your garden. But you have to make the motor behavior first, the movement behaviors. So we're going to go ahead and practice real quick before we move on to the next session or next section. I want you to stand. First things first, soften your knees. You'll automatically feel your weight shift to your heels. I want you to look up and then push through your heels. Feel your behind turn on. And then I just want you to hold on to that wall, that sink, whatever you're standing by. I'm using a dowel. And I just want you to blow out all your air like it's your 100th birthday. Feel your belly get tight. Hold it tight. Hold your knees soft and your pressure through your heels and breathe in through your nose. And I don't know if you can see this because of the mirror, but I want you to watch the backside of my body expand when I take this breath. I'm going to inhale. Watch my body expand. You'll see that I expand in my chest, and I expand in my back, and I expand in my lower back. What you don't see is you don't see this. You don't see me folding open and closed. Because when I breathe the way I've showed you, I let my body grow with every inhale, and then I let it shrink with every exhale. That's the way that we not only hold our body in the right position by pushing our heels into the floor and breathing, but we allow muscles to stretch from the inside out and also shorten from the inside out, okay? That is a very important strategy with those two things I just showed you. If you do 5 rounds of 5 breaths, in standing preferably, or sitting if that works better for you, you'll find that you're going to start loosening up parts of your body that are kind of maybe feel weak or constantly stretched or expanded will start to tighten up. But the beautiful thing about what I just mentioned to you is that things that are tight will get to shrink and then loosen again. And things that are tight will get to loosen and then tighten again. That's that left, right, front, back, alternating and reciprocating, as we call it in the biz, motion that I want your body to be able to do. Now, I like to dance. I don't claim to be a good dancer, but everybody knows that dancing is in the hips, right? Well, if you're following along and you're doing this with us, I want you to take your paper towel roll. I want you to put it between your legs. I want you to set yourself up in that seated position. Nice upright, just sit tall, put your hands on your legs. And what I want you to do is I want you to put your arches underneath your knees. Push your heels into the ground. And I just want you to take a nice big exhale. You don't have to blow out all your air. Just feel your belly get a little tight, maybe moderately tight. Hold it there. Take a breath in through your nose. Now what I want you to do is when you blow out your air the next time, I want you to push your right butt cheek forward. And I want you to just let your left knee, your left hip come backward. If you feel like you get a pinch at the front side of your hip on the side that's coming backward, I want you to push a little harder with that heel. Then when you take an inhale in this position, I want you to exhale and push your left hip forward. Let your right one just come back. Still keeping your heel pressure on, so your hips are underneath you. Still maintaining a little bit of belly tightness. Take a breath in there. And push the other hip forward. You can continue to take these breaths in at that turn position and then out as you switch sides. Sitting is a nice way to feel this, but it's best done in standing because this alternating and reciprocating, left, right, front, back, on, off, is most important when you're navigating your environment, okay? So what that's gonna look like, so I want you to take your foam roller or your paper towel roll. I just want you to kind of observe what I'm gonna do here. I'm gonna keep my knees soft, put pressure through my heels, exhale completely, and then I'm going to inhale, and I'm gonna push my right hip forward. And you'll notice that rather than swaying side to side, I kept my entire foot on the ground, left to right, inside to outside, which produced this rolling of the paper towel. It didn't sway side to side. This might be difficult for you to control initially. But what I want you to think about, as long as you have that heel pressure and your hips underneath you, and you're doing the breathing like I showed you, keeping your belly just a little bit tight, you're going to get more motion eventually with practice. So I'm going to go ahead and do 5 or 6, and you can do them with me. I'm going to put pressure into my heels. I'm going to feel my hips tuck. I'm going to gently hold on to this, blow out all my air. I'm going to take a breath in with the belly kind of tight, my heel pressure still on. And then I'm going to exhale as I put my right hip forward. You'll notice the roller rolled that direction. My belt buckle turned that direction. I'm going to take a breath in. And then I'm going to exhale. I'm going to push my hips straight forward. If you pause here and you look down, you can see that your knees are in line with your feet. They're not outside or inside. They're directly in line. My hips are turning and my legs are going forward and backward. I'm going to take a breath in here. And I'm going to exhale. Again, this leg comes straight forward. This one comes straight back. My belt buckle is pointing left. I'm going to take a breath in. And then I'm going to exhale. Take a breath in. Belt buckle's pointing towards the right. I'm going to push it to the other side. If you find that you're having difficulty completing this, what you can do, I'm going to turn my computer around really quickly so you can see what I'm about to demonstrate, is you can go to a wall. Oopsie, excuse me. You can go to a wall. I'm going to use this cabinet here. I'm going to soften my knees. I'm going to lean into the wall. I'm going to push my heels into the wall so I feel my low back on it. I'm going to blow out all my air. I don't have my foam roller, but watch my belt buckle. I'm going to inhale, and I'm going to push my left hip or my right hip forward. My left hip will go back. My belt buckle will point towards the left. I'll feel my left low back on the wall. My right low back is going to come off of it. I'm going to take a breath in, and I'm going to push my left hip forward. And I'm going to feel my right low back on the wall. My left low back has come off. My belt buckle's turning towards the right. Now, if you want to upgrade, you don't want to be on the wall, but you want an in-between to those two positions, leaning against the wall or standing free. You grab onto your kitchen sink. You put your heels into the ground. Your arches are below your knee. You exhale. You take a breath in silently through your nose. And then you push one hip forward. You inhale once you've pushed that hip forward. And then you exhale. You push your left one forward. Hopefully by now you've sort of started to get the gist of how this alternating fashion works and ways you can capture it. You have to first set the stage by pushing your heels in the ground, getting your pelvis underneath you. Then you secure that position with your breathing, which again, you're going to be doing, hopefully, for now until forever. And then you just work on shifting those hips. Where this becomes applicable is that when I'm walking towards this camera and my belt buckle turns right as my right foot is forward, and then it turns left as my left foot is forward, that is no different than pushing my right hip forward so my belt buckle goes left. Pushing my left hip forward so my belt buckle goes right. Excuse me. This is where the carryover is. We pay attention to what we're doing. We pay attention to what we're doing. We make it easy on ourselves to learn these things. And just like that car ride on that trip that you took the first time, by the time it becomes your 50th time, it's going to be automatic. That's the movement behavior. So when I come right here again and I go, my right behind is pushed forward. You see this muscle's flexing. My left front is working to kind of help keep me there. And then when I go, and I bring myself the other way, my left behind is working. It's firm. And my right front is working. That alternating fashion, combined with putting our hip pelvis in the right position and holding it there with our breathing, is what allows these muscles to lengthen and shorten like they're designed. It's what allows these joints on the back of your hips to move. What they really will do is they'll kind of tip forward, backward ever so slightly as we carry ourselves through space. It's going to allow these lumbar vertebrae to be secured not only by the abdominals, but to only move as much as they are designed to, not to be overused to get your tasks accomplished. It makes you more efficient. It makes you approach a situation under any environment that's going to allow for you to move economically and spare your tissues. Be efficient. The last thing that I'll kind of mention about this too, and then I'll show you one move for the people that have kind of stuff here on the outside of their hip, and then I'll show you one move for people that have stuff on the front of their hip, in addition to that orientation drill. The last thing I'll say about arthritis, for example, everybody's got arthritis. There's actually like a percentage per decade life correlation between the two. That means 10% of 10-year-olds have it and 80% of 80-year-olds have it. It's a sign of life, but it can be kept at bay. In my personal opinion, there's 3 ways that arthritis occur. The first one is you have a rheumatic disease. You have something that just creates an inflammatory response in your body and things just degrade. The second one is you have an acute injury. If you fall off a truck or a ladder and you land on your neck or your knee and you damage that tissue from hard impact, you're going to get arthritis. The third way uses a physiological principle called Wolff's Law. Simply put, a bone that's constantly pushed on will grow. A bone that's constantly pulled on will grow. That's why we have these lumps and bumps on our bones. You might have one here at your elbow. I hope you do. That bony part of your elbow is because this triceps pulls on it every time you straighten your arm. Now you might ask me, Sebastian, how does arthritis fall into this? Well, let me tell you, if you can only move your hip up and down doing your behaviors, but you can never use the front part of it, well, you're creating constant unrelenting pressure on the back side of your hip. If you're only using your front of your hip, like you're that knock-knee person, for example, then you're only putting pressure on the front side of your hip. Wolff's Law says if you're putting pressure on a bone, it will grow. Now, if you can go through space and you can go left, right, front, back, you're giving your body the opportunity to distribute forces. You're creating longevity. Now, if you make it to be 150%, you will have arthritis. But the severity will be much, much less. You can avoid a replacement if you move through space in this alternating fashion. Now, that move I promised you, if you've got something on the side of your hip, chances are you're kind of stretched out. You're one of those people, every time you take a step, you go, ooh. I don't want you to be that person. A nice, easy way to train that is to work the muscles on the back side of your hip. For those of you that have balance issues or you feel like you kind of get wobbly or you're really weak, I want you to hold on to a sink. And all you have to do is you open that cabinet door underneath your sink. So you put your foot in there. If your spouse doesn't like that, then you have to compromise somehow. But you'll notice if I'm lazy here on my left leg, you see my hip kind of shoot out. Well, if I push on your heel, which is your backside's best friend, whoop, you'll notice now I flatten that hip out. I turn those muscles on the backside of my body, and I can float my leg. If I get lazy, picking my leg up is harder. Using the front of my right hip is harder if I don't use the back of my left hip. So what I do is I push my left heel hard to the ground, I stay tall. It automatically raises that right side and allows me to freely pick up this leg. This is how athletes work, okay? You can switch sides. So if you've got pain on the outside of your hip, this also helps you turn, just like I showed you earlier, but it creates activity on the backside. If you're one of those people that every time you bring your knee to your chest, you feel a pinch or you sit down on the couch, you also want to turn on the backside of your hip. But you want to pay special attention to breathing, because often you don't have a problem getting your pelvis here. If the heel pressure doesn't clear it up, it's holding it there. If you've got pinching in the front of your hip, muscles that bring your leg up towards your chest are trying to give you, quote, core stability. You need to be using your belly muscles, not the muscles that bring your leg to your chest, in order to solve that sort of pinching feeling. So again, if you're one of those people that has pain on the outside of your hip, you need to push your heel into the ground. You need to practice being strong on one leg. If you're one of those people that has pinching in the front, you need to practice, again, pushing into the floor and taking deep breaths so your belly works. And then being able to breathe on top of that, keeping those abs on. But if you can put your heels in the ground, you can learn to shift back and forth and breathe with tight abs. I guarantee that your hips are going to start to feel better, your back will start to feel better, your knees will start to feel better. And if they don't, come and see me and I will show you the way in person to make it a reality for you. Because again, I use these strategies on a day-to-day basis to help people take control of how they get through space. I showed you that squat earlier, and I taught an 83-year-old man, no joke. Granted, I mean, he was fit and was able to do it, but he got down into a squat for the first time, and his wife said, don't show off. You can only move like this, but if you can't get your hips underneath, you'll never be able to realize your full motion. So we've got 5 minutes left, or just about. We'll give it a little bit. If anybody has any questions now would be the time. I'm going to swing back around so I can see you. But I just want to say thank you to Jill. Jill, you're an amazing person. I want to thank you for joining this and Boise Communication as well. And having interest in how to take control of your physical health, because it is the one thing that you can do all the time. You just have to think about it. And if you have trouble thinking about it, you need someone to hold you accountable. Myself or someone else at our clinic will be the right person to kind of get that done for you. But if you do come and work with me, I'm going to make you work. That's my only, I guess I would say, not an ultimatum, but that's my only condition, is that you have to be able to work. So I'm going to go ahead and flip this camera around. And if anybody has any questions, okay, we got quite a few.
Add a comment, Sebastian, because I know this is your philosophy as well as everyone at our office. None of this should be painful, okay?
No.
If you're trying this and you go, oh man, that hurts, and then you think, oh, but I'm supposed to do this, you should not push through pain. So if there is pain during it, mechanically something is misfiring or not moving, and that's when you want to seek professional help.
Exactly.
See one of us to see what's going on.
Right. And yeah, again, like in the beginning, this isn't a replacement for coming and seeing one of us or seeing a doctor or whatever. But generally speaking, you should be able to create these spaces. If you're not able to do that and you're feeling that pinch, regardless of these cues that I gave you, as Jill said, you probably have a little something that needs a little extra attention. You probably need a closer eye than can be given through, obviously, a computer screen. You need me or someone else in person to say, no, feel this muscle or shift this way, etc. But so Jill said, yeah, okay, the psoas muscle does pull the hip to the flesh is a hip flexor, pulls the knee to the chest. When the right leg moves forward, the back right leg tightens in the left front. Exactly. So you want to feel, Amanda, you want to feel your glutes. Your glutes are pushing your hip from the back forward. The adductor on your left leg is what's going to help turn your pelvis that way. So really quickly, I'll just kind of point on myself. Oop. Let me see if I can angle this down a bit. Your adductor is your inner thigh muscle. It's super duper long and it attaches right here to your pubic bone. Your glutes attach to or start from your sacrum, attached to your thigh. So if I squeeze this muscle and I pull this way, whoop, then it turns, and the adductor then helps keep my pubic bone oriented in that direction. It's what allows me to transfer weight from my right foot to my left foot, so I can now transition from a front left leg muscle to a back right or back left muscle to push myself back onto my right leg. Okay. Yep. You got it. So does that clear up your question? Yes, exactly. Jill wrote it perfectly. Great class. Thank you. Well, I'm glad. Does anybody have any other questions? Sally, Mary, Jill, Linda, Bets, Judy, Nancy? But I hope there was did everybody find something useful? This is my first time doing this sort of thing.
I have a left hip replacement.
Okay.
And that's the one that's on the outside. So that does, it's probably just I haven't used the muscles there enough.
Yeah, and so I actually get that a lot, Mary, is that, because think about it. Did they go into the back? Do you know where they went in? It's
over at the side. It's not the front one. It's the side. It's the back side.
You have to think about, like, not only did you have the hip replacement, but a lot of the attachment points and the muscles that help push your hip from the back over there, they were in some way, shape, or form, I mean, I'm just going to say damaged, right? Because surgery does have to cut through stuff. And it kind of sidelines them for a little while. So short answer is yes, you just haven't been able to re-recruit those muscles. But I bet you carried on with your life, am I right?
Oh yeah, oh yeah.
Yeah, so you were now developing compensations during your healing process to avoid using those injured tissues. So you kind of learned how to do it the other way. But you learned how to do it the other way at the expense of kind of that discomfort. And there is a way to train that. That exercise where I said, like, standing at the sink, if you just open up that door, put your left foot in nice and secure, and you just work on straight leg, pushing your right heel as hard as you can to the ground, you'll feel that muscle start to talk to you. You'll feel it start to get warm. You'll feel, and if you need to, just tap yourself in the butt. There's no shame in, like, giving yourself that feedback.
Okay.
You know, I do that all the time. I exercise on a daily basis and I film myself exercising. It's a learning process at any age.
Okay. Thank you.
Yeah, you betcha. Anybody else? All right. Well, if no one's got any other questions, thank you so much for joining.